Recording in progress.
Good morning, everyone. We will go ahead and get started. A copy of the Open Meetings Act is located on the north wall of the legislative chambers, and it is also available on the county board's website. There's also an automatic external defibrillator on the back wall of the legislative chambers. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Before we get started with our meetings, on behalf of the county board, we would like to congratulate and welcome our new Commissioner, Roger Garcia, who will be sworn in next Monday and take a seat here with us on Tuesday as his first meeting. So we all, again, wish him congratulations and look forward to having him with us on the county board. With that, we will begin with the Douglas County Board of Equalization. Roll call, please.
Commissioner Boyle? Here. Commissioner Kavanaugh? Here. Commissioner Friend? Here. Commissioner Morgan? Here. Commissioner Rogers? Here. Madam Chair.
Present. Item A, approval of the minutes of the Board of Equalization meeting held Tuesday, October 19, 2021. And item B, call for a meeting and set Tuesday, November 2nd, 2021 as a date for hearing on certified assessment corrections reflecting the addition of omitted property to the tax rolls or increased value on property. Is there a motion to approve A and B? So moved. Any questions or comments? Motion by Commissioner Rogers, seconded by Commissioner Morgan. Please vote.
Motion passes 6-0.
Citizen comments. Is there anyone in the chamber wishing to speak to the Board of Equalization or on Zoom about an item not on the agenda? Seeing none, there are resolutions D through G. Is there a motion to approve?
Motion to approve and adjourn.
Any questions or comments? Please vote.
Motion passes 6-0.
We'll now move to our agenda for the Douglas County Board of Commissioners. Roll call, please.
Commissioner Boyle? Here. Commissioner Kavanaugh? Here. Commissioner Friend?
Here.
Commissioner Morgan?
Here.
Commissioner Rogers?
Here.
Madam Chair.
Present. Item A, approval of the minutes of the Board of Commissioners meeting held Tuesday, October 19, 2021. And item B, approval of claims submitted for payment processed through Tuesday, October 26th, 2021. Is there a motion to approve A and B?
So moved.
Motion by Commissioner Rogers, second by Commissioner Morgan. Any questions or comments? Please vote.
Motion passes 6-0.
Next is our consent agenda, items A through J. Is there a motion to approve?
So moved.
Motion by Commissioner Rogers, seconded by Commissioner Morgan. Any questions or comments? Please vote.
Motion passes 6-0.
Next are citizen comments. Is there anyone in the chamber or on Zoom wishing to speak to the Board of Commissioners about an item not on the agenda?
Good morning, Ari Store, 5015 Lafayette Avenue, Omaha, Nebraska, and that's the only address I've ever had since 1971. If you want the other ones, I'd be happy to supply them.
No, thank you.
Anyway, I see that the city has a controversy going on now that used to be a controversy in this chamber over juvenile detention and juvenile programs. It's really getting confusing for a citizen to understand what's going on in this county and this city. Now they're taking over a church on North 50th Street, half block south of Ames Avenue. For kids that are troubled, and maybe it's a one-stop share center for everything they possibly need to keep them out of jail. We've had this discussion for quite a few years in this chamber, but it's been quiet recently. But following the online edition of the Omaha World Herald, there are a lot of citizens that are rather mad about it, particularly the citizens that have rather nice homes right in that same block, because there's not much talk about the safety for them. I would imagine that these kids are going to be transported so that they don't have to be seen in shackles. I know there's a big parking lot for outdoor exercise, but I sometimes wonder about what happened to the Juvenile Justice Detention Center that we all ended up not being able to vote on, that's being paid for with something that somehow comes out of our tax dollars. I guess the story kind of sounds like a lot of people feel, well, it's all about the judges. The judges got their little place to walk across without having to drive to the property out on 42nd and Center area that we already own and has lots of territory to expand on. A little bit of fix up here and there, and everybody probably would have been happy, because there's a family one-stop shop center right across in the old Center's parking building, shopping center, I'm sorry. A lot of them right there. I don't know how that's so difficult for judges to get out there and for parents to get out there, because they're probably in the shopping center area anyway for other reasons. So, you know, we citizens would like you to stop pulling the wool over our eyes. Somehow things got shifted from the city to the county and back to the city now with a one-stop shop center out there. Seems to a lot of us that it's a bait and switch. Make a controversy over juvenile detention because the judges don't want to drive out to 42nd Center. I think it's time to stop. Thank you.
Anyone else wishing to speak to the board? Luis?
Luis Jimenez, 2709 Dewey Avenue. Good morning, Commissioners. I want to talk about the appointment committee and also some of the things that were discussed there. There was members of the appointment committee who complained that District 1 vacant seat should have been filled by an election. And I have heard on various occasions that we need to save money, and elections are an opportunity. For example, a lot of citizens would like to see the Omaha city elections moved to during the national elections. That would be one way to save money. Another thing that could have happened, which was kind of a thought experiment that I did, was that the county board could have filled the vacant seat, and that would have saved some money as well. I'm glad that did not happen for various reasons. I thought that the process was good. I told the committee as such that having the appointment committee select a replacement would be good, and I think that Roger Garcia would agree that that was a good process. One thing that a lot of the
Could those
applicants-
on Zoom please mute?
One thing that the applicants discussed was the juvenile detention center and the programs. I hope that you reach out to some of those applicants, like Kimmer Snipes, who's been working with youth here in the county, and perhaps set up a juvenile program intervention committee or the like, and take care of that committee logistically, administratively. I know that you trimmed down your committees at the beginning of the year, which, you know, was probably something you need to do because they weren't meeting. But if you take care of your committees, they will meet. They'll come together and meet. And that's about it. Thank you.
Anyone else wishing to speak to the Board of Commissioners about an item not on the agenda? Seeing none, we will move to our presentations. Our first is our COVID-19 update and COVID-19 vaccination plan update, presented by Carol Allensworth for Dr. Lindsay Hughes. Good morning, Carol. I'm looking. Mm-hmm. Good.
Well, good morning, Commissioners.
Morning.
I hope you're having a good day. I'm here to give you the update on all things COVID from the Health Department today.
Could you pull the microphones a little bit closer to your...
Let me know if you can't hear. I have kind of a bad voice.
You might want to just take that off while you're talking today.
Okay.
There you go.
That's better. Anyway, here in Douglas County, we are still at high risk of transmission, as you can see on our homepage. Our 7-day cases per 100,000 are sitting at 161.4 per 100,000. And what we're seeing is about 100. This doesn't look updated. Sorry, they must have updated for today already. So we're sitting at 171 cases per 7-day total. And we're seeing an average of about 140 cases per day. Last week, we were at 150.4 cases per 100,000. So we have seen an increase in cases since last week. The total number of cases that we've seen so far this week, I gotta see if they updated this. Yeah, we're sitting at 86,794 cases, and that is as of today, with 825 deaths. Our cases increased about 5% last week from the week before. But overall, our trajectory of cases has been going down since the beginning of September. So we've seen a little seesawing of our cases by week. But like I said, overall, our trajectory is going down. And if you look at the cases by age group, again, we're seeing our largest amount, or 28%, among our 0 to 19-year-old age group. We did see some increases among our 40 to 49-year-old case-wise last week, and we will be watching that pretty closely over the next week. We have a map here. Karen, how do I get rid of your talking piece right here? Oh, perfect. Okay. So our map of cases, our weekly cases, is right here. And you can see what we have been seeing is some of our centrally located zip codes have a little bit higher number of cases being reported. But some of those zip codes are our highest population zip codes as well. So as far as hospitalizations, we had 195 hospitalizations as of last night. 2 of them were pediatric cases. There are 32 vents that are currently being used by COVID patients in the hospital as of yesterday. We are at an 86% occupancy in our med-surg beds, and we're at a 90% occupancy in our ICU beds. As far as our pediatric ICU beds, we are sitting at 70% occupancy. I just want to remind everybody that this is a regional look across all of our systems, which means that some of our individual hospitals and some of our systems may very well be at capacity, because this is a look regionally. So as far as vaccinations are concerned, among eligible Douglas County residents, that's 12 and up, we are sitting at 69.8% fully vaccinated. I'm anxiously awaiting to hit 70%. If you take a look at our entire population, 57.7% are fully vaccinated. One of the things I do want to draw your attention to, and I know that Dr. Hughes has mentioned this in the past, and that is the fact that we do see some differences by race and ethnicity as far as full vaccination is concerned. However, I do want to bring to your attention that among the Black population and among the Hispanic population, they have a significantly larger proportion of their population that's under the age of 12 and therefore not eligible for vaccine. So if you look at our Black population, 12 and older, the percent that are fully vaccinated is 47.4%. So it jumps up quite a bit. And if you take a look at the Hispanic population, who has 28% of their population that is not eligible for vaccine, that jumps up to 69.6%. Our white population, in contrast, has only 14% of the population that is, under the age of 12. So if we just look at 12 and older, we would be looking at 63.8% fully vaccinated. So as far as our clinics are concerned, we do have pop-ups this week. Wednesday, we are at St. Clair Memorial United Methodist Church at 44th and Ames, and then at the UNO Library as well. Saturday, we will be having a pop-up clinic at the Trunk or Treat Village at 24th and Lake. And one thing I do want to tell you, those pop-up clinics will have Pfizer vaccine only. And then at the Douglas County Health Department clinic today, Thursday and Friday, we have clinics. And then we also have our drive-through clinic that's available on Wednesday and on Saturday. The Douglas County Health Department clinic and the drive-through clinics will have all 3 types of vaccine available. Now, as far as another thing too that you might be interested in, the total number of 3rd dose or booster vaccines that have been given to Douglas County residents is 37,610. So we're doing a lot of booster vaccinations. And in fact, 68.6% of all vaccines administered in Douglas County last week were booster doses. So as far as the news is concerned, of course, last week, Moderna and J&J boosters were approved by the CDC's Advisory Committee on Immunization Practices, or ACIP, and they also approved a mix and match with the different types of vaccine if needed. So as far as Moderna is concerned, Moderna is a half-dose booster 6 months or later after your first. For those people 65 years of age and older, adults 18 to 64 at high risk of severe disease, and for those with frequent institutional exposure to the virus. The J&J booster is approved for all adults 18 and older, as long as it's been 2 months since your first dose. Now, the FDA is meeting today to look at and potentially approve vaccinations for the 5 to 11-year-old population. Now, that's just the first part of the approval process. Next week, CDC's Advisory Committee for Immunization Practices will meet to look at the FDA recommendations, and they will make their recommendations and/or approval. Now, at the latest, the Douglas County Health Department will be providing Moderna and J&J boosters by tomorrow. That's at the latest. It all depends on when we get our orders in place. And then I want to remind everybody that the pop-up clinics have Pfizer vaccine only, and that if you are looking to get a booster of Moderna or J&J, you will have to go to the health department or through one of our drive-through clinics, from us anyway. They'll probably be available at other places, pharmacies, doctor's offices, etc. So unless you have any questions, that's my update for today. And sorry about the voice.
Oh, no, thank you, Carol, you did great. Commissioner Kavanaugh?
Thank you. Just a couple quick questions, and thanks for this. You probably followed this when the doctor is here, but I always ask, well, what is our positivity rate percentage? I know there's a graph here, but it doesn't actually give the percentage. If you know.
If you mouse over it, yeah, our percentage as of yesterday was 7.2%.
Okay. And if memory serves me, that might be down a little bit from last week.
A little bit.
That's good. On the breakthrough graph, it has we're at percent of fully vaccinated people who became positive breakthrough cases, 1.5%.
Right.
And that seems to be just, I don't know, maybe a 10th or so percentage point up from last time.
It is. And the more people that get vaccinated, that percentage is going to go up a little bit, because no vaccine is 100% effective.
Right.
So we would anticipate some small increases as the number of people who are vaccinated increases.
And I heard and read on the national news, and we're pretty close to the national percentage. I think the national percentage of fully vaccinated is about 57%, and we're over that at 57.7%. I think that the national average on breakthroughs is about 1% and change.
Yes.
But I understand from the national figures that almost 100% of the deaths from COVID currently are people who aren't vaccinated. Is that correct?
Yeah, the vast majority of deaths that occur in individuals due to COVID now are in the unvaccinated, but that proportion is going to range, there's going to be a range of that, 90, 97%. I think in the state of Nebraska, the most recent figures they released were that 96% of the deaths were in persons who were unvaccinated.
Okay. Thank you, and thanks for this report.
You're welcome.
Commissioner Maureen Boyle?
Yeah, thanks again for that report, too. Just a couple comments to add is that it still disturbs me that the hospitals are at such high capacity. To state that the hospitals are the beds are 80%, 86% occupied. It just keeps hovering, I mean, clearly above that 80%, especially that 90% of ICU beds are occupied. And I think what bothers me the most is, from what I understand, the governor said that hospitals can resume usual activities, which means we can do non-urgent surgeries. So that's only going to put more pressure not only on the bed availability, but also on the staff. So we have to remember that a lot of staff is burnt out. A lot are choosing other places to work just because hours can be better, lifestyle can be better. So I think we just have to continue to have an awareness of I feel like the community says or feels that COVID is going away, and it's really not. I think we're just getting COVID fatigue about hearing all this data. So just understand that the hospitals still do have a heavy burden, still do have are very busy with COVID patients. As an example, I work for Methodist, and they give us information about the hospitalizations for vaccinated versus unvaccinated patients, and the number of vaccinated patients that are hospitalized is increasing. The number in the ICU, though, is predominantly those who are unvaccinated, and those on ventilators are all unvaccinated. So just that point to make. Second, I do find it very valuable that you broke down the vaccination by eligible population, because I think that sometimes we feel like we're not doing a good job supplying vaccinations to our populations who are most at risk. When you break it out like that, I think it gives us a better understanding of why. Of course, still the effort needs to go towards those populations, but at the same time, I think that makes me feel just a little bit better about that fact. And then third, I was just asking for a comment on you about cross-vaccination. So like being vaccinated with Moderna, getting the Pfizer booster. I know there's been some information about that, and I was just wondering if you could comment to that and whether you know if that helps with antibody formation with cross-vaccination. And I know there's not a lot of data out there yet, but what are your thoughts?
Basically, we at the Douglas County Health Department follow CDC recommendations. At this point in time, CDC has made no statements or recommendations about whether X person should get this or X person. They're just basically, we are going to be leaving it up to the client themselves. So if we have a client that comes in that wants J&J as their booster, wants Pfizer, wants Moderna, we will take their request. Because at this point in time, CDC isn't going any further than saying it's okay to mix them. There are some studies out there, but I think the science is not totally solidified about that yet.
So you know how patients are, though. They'll say, what would you recommend?
Yes. And we actually are, Dr. Ann O'Keefe, our senior epidemiologist, who is a preventive medicine physician, will be taking some of those questions when they become difficult for our clinic staff.
Okay, thank you.
Commissioner Kavanaugh?
Thank you. Just one last question. Regarding the deaths from COVID in Douglas County, I think the number reported is 825. And we check this every week relative to how many deaths in the last week of that 825. Are deaths increasing, decreasing, and staying about the same?
Last week, for the week ending, this last Saturday, we received 7 death certificates. The week prior to that, we received 17. But remember, that's when we received the certificate, not on the day they died. The graphic that's up on the dashboard shows you the deaths by the week of death. So, we report them when we get the certificate, because we do not report a death until the death certificate is complete. And so that may follow the death, from 2, 3, 4 weeks. So if you really want to take a look at when the deaths were occurring, I would encourage you to look at this graph, because this is deaths by week of death.
And that's the lower right-hand
The
corner?
lower
the
right-hand
red,
one.
yeah. So
And
it
if you mouse over, any one of those bars, it will tell you which week and how many.
Okay, thank you. So it's total of 825.
Yep.
Thanks.
All right. No other questions or comments? Thank you, Carol, for being here and giving the report today.
You're welcome.
With that, we have a presentation on the Douglas County Youth Center 2021 third quarter data and updates. And Commissioner Rogers, did you want to start off with anything on this?
Thank you, Madam Chair. No, just that this is just a quarterly update coming to the board. We went over information last week in the Child and Youth Services Committee and had an in-depth presentation about the Family Resource Center. So Abby will go a little bit into the day-to-day, and Kim will continue from there. Abby.
All right, good morning,
Good morning.
Commissioners. My name is Dr. Abby Carbaugh, and I'm the Juvenile Justice Data Administrator here for the county. So I'm going to give you a presentation today, an update on some of the information on trends that I gave you about 6 months ago, so you can see just kind of what our population's been doing, who we have in the youth center. And then I do know that Superintendent Alexander is on the call, so if you have any questions, he and his staff might be able to answer some things that I'm not equipped for. Okay, so our first graphic here, we just have our average daily population in the youth center. So we did have a pretty significant decrease in our population over the spring and early summer. We were down into the 40s in April and May, and that is including the about 3 youth we hold each month for Sarpy County and other agencies. So our numbers have gone back up a little bit. We were sitting right around 60 at the end of September, and that is comparable to where we were sitting in last fall. So our numbers have continued that sort of downward trend from where we started in 2019 and that first half of 2020. So when we look at the youth in terms of which court they've been committed to, we're seeing about a 60-40 split. So about 60% of the youth we hold on any given day are awaiting charges in juvenile court, and about 40% are awaiting charges in adult court. Last fall and earlier this spring, we were kind of about a 50-50 split, and now we're getting a few more youth who are awaiting juvenile court charges. With regard to overall admissions, our numbers continue with this downward trend. So we are sitting at 429 admissions through this calendar year through the end of September. And that's pretty low, or that's a lot lower than where we were sitting relative to the third quarter of last year. So I expect we'd end this year around 400 or 575 youth or so in terms of our total number of admissions. This shows you those numbers just kind of broken down by the admission month. So again, you can see earlier this spring, we had some pretty low admission numbers, and that went up again this fall in August and September. One of the interesting things that we are looking into, we did have a pretty big spike in the number of admissions for girls. So in August, we had 22 girls admitted, which is double what we normally see, and it's just an anomaly for that month. So we're going to do some digging and see if we can determine what caused that, but just something to take note. So again, breaking the admissions down by court type, we see some general declines. The admissions for youth admitted for charges in adult court are remaining relatively consistent. So I would anticipate we'll end the year at about 85 to 86 youth charged in adult court. So not too much of a change from where we were last year, but still a bit lower. The numbers for youth admitted with charges in juvenile court does continue on that steep downward trend. So we'll probably end up around 460, 475 youth in the juvenile court system. In terms of case status, we continue to see that most of the juveniles admitted are either pre-adjudication status or are pre-trial status, so we're not holding many youth in detention after they have been sentenced or adjudicated. And then this is important, the length of stay. So the last time I was here, we noted that we'd seen an increase for the youth charged in both juvenile court and the youth charged in adult court with regard to their length of stay. And now we're seeing that coming back down in 2021. So we have a really big peak in 2020, and then it's coming back down. And a lot of that can be attributed just to COVID and the court process and the other processes sort of stalling. So we have come down to 38 days as our average length of stay for youth with charges in juvenile court, and we're down from 181 days to 115 days for youth awaiting processing in adult court. This does exclude youth who are booked and released on the same day. About 40% of the youth charged in juvenile court are booked and released the same day, and about a quarter of the youth in adult court come in and are released the same day. With regard to admissions and the demographics, again, we see primarily older youth coming in. That 15, 16, 17-year-old range is the bulk of our population. It was about 2/3 of the youth charged as adults and about 80% of the youth charged in juvenile court. And then we also see some disproportionality by race and ethnicity. So we have about 3/4 of youth detained on juvenile charges are not white, and about 85% of the youth on adult charges are youth of color. And one thing I added to this slide is just the overall demographic breakdown for Douglas County as a whole. So we see 11.4% of the countywide population is Black and 12.9% is Hispanic. So we are seeing, when we have about 55 to 60% of our youth in the juvenile center are Black and about between 15 and 30% are Hispanic, we do have some disproportionality going on there. With regard to why the youth are coming into the youth center, it's primarily for new charges as opposed to technical violations in both juvenile and adult court. With regard to juvenile court, those new offenses are pretty well a mix of interpersonal offenses and property offenses. So theft, assault are the two consistently highest reasons. I guess that's a very bad way to phrase it, but you know what I mean. Yeah. So theft and assault are the most common reasons that youth are admitted into DCYC on juvenile court charges, and that's been consistent for the last 3 years. The other charges listed there: drug possession, weapon possession, robbery, burglary, sexual assault, and then terroristic threats or witness tampering, evidence tampering. Those sorts of things they've all been predominant reason for admissions over the last 3 years. The ordering of them just kind of changes. So these are the top 8 admission reasons why people come in. And then when we look at technical violations, we're seeing a lot of unlawful absence, violations of probations, and then a few failures to appear and violations of the home program. When we look at the youth charged in adult court, the offenses are a little bit more skewed towards the interpersonal offenses. So robbery and weapons use are the primary factors that result in a youth's detention on adult charges. Then we also see some charges in terms of accessory, weapon possession, theft, and then a few for sexual assault and physical assault. With regard to their technical violations, we're seeing things such as failure to appear for county court, being held on fines and costs, or being held for district court. And then the last thing that I wanted to go over is just the population in terms of zip code and where these youth are coming from throughout the county. So when we look at the snapshot population from last Thursday, we see that predominantly youth are coming from the eastern half of Douglas County, and most of our admissions are from zip codes that are either north of Blondo or south of the I-80 interstate. We do have 7 youth who were admitted from outside of Douglas County. Again, we had 3 that were being held for charges in Sarpy County, and then we had 1 youth from Council Bluffs and 3 youth from Sarpy County who committed their offenses here and are being held on charges related or in Douglas County. So if we take that and we look at it just from a more longitudinal perspective and we take it back to 2007, we see the same sorts of trends. So the darker colors, again, are skewed more towards the eastern half of the county and, again, more towards the north and the southern portions. And so I think what this indicates to me, at least, is that what we saw in the snapshot population is not an anomaly. It's just sort of a longer-term trend of we have youth consistently coming from certain areas of town and we have some certain demographic characteristics that are overrepresented. And these are just trends that have been consistent over time. They're things that we are looking into, things that we need to continue working on, but they're also things that are not necessarily unique to Douglas County or to the youth center specifically. We see these at multiple points throughout the criminal justice and the juvenile justice system. So these are the updates on the data that I have. So let me know what questions you may have.
With that, Commissioner Kavanaugh?
Thank you. Thanks for this.
Thank you.
The average daily population, and I think this is right up in the front. On page 2, it would be helpful, this is a addition
Yeah.
question. If we had a cumulative, what was the average daily population annually in 2019 versus the average daily population annually in 2020 versus the average daily population year to date
Sure.
in 2021. Like everything else in our world, jail populations are affected by COVID. And so we're seeing some numbers coming down in 2020, which is good. We want to see those. They also coincide with the onset of the COVID pandemic. So if you could, not right now, but subsequently, just give us a cumulative running total on the average daily population. It's a pretty important stat, and it would speed things up in our analysis if we had that. Thank you.
Absolutely. Thank you.
On page 6, we have this admission by court types, and it looks like there is, again, a partial year in 21, so it's difficult to compare, but between 19 and 20, there are some changes here. And again, I don't know if that is due to the COVID pandemic, but we see, for instance, in juvenile court admissions, 812 in 19 down to 609 in 20, and in adult court, 127 in 19 and 96 in 20. I guess this begs a larger question. So if we did that graph on the charges filed, whether they were admitted to custody or not, what would that look like? Because the total number of charges is, the total number of kids, basically. And so how does that reflect over that time? It might be, and I know this from talking to judges and prosecutors and defense attorneys, that there was a tendency not to incarcerate maybe as many children as had been incarcerated pre-COVID because of COVID. And so if you could provide us with that, what's the overall charges in juvie court and district court for these kids over the same period of time? That might reflect something.
Yeah, no, I think that's a very interesting question. So I don't have access to that data directly just because I work primarily with the youth center, but I am working with the JDAI committee to look at these different, just different characteristics across all the points of the juvenile justice system. And so we have been working with the county attorney's office to get that data. So hopefully once we get that, I'll be able to include that in these presentations and give you more insight into that as well, because that is an important question.
Right. Yeah, I mean, in the universe of juvenile justice, that's the overall number. How many kids are being arrested and charged?
Mm-hmm. Yes.
And, admitted to incarceration is one thing, but the overall, are the same number of kids being arrested and charged? Are they following this trend? Are fewer children being arrested and charged?
Mm-hmm.
Those are numbers that we would like to have. So that goes to the other
1 minute.
charges, and we might have to come back up or down relative to the admissions thing over this same period of time. If you could provide me with that information, I'd like to see that. And then on page 10, it appears that we have consistent majority-minority populations incarcerated, kids of color
Yes.
locked up, and I'm trying to do the math here again on this, but it would appear to me that way over maybe 60-40 kids of color versus white kids locked up, right?
Yes, it's probably closer to about 75-80%, depending on which court type you're looking at.
And again, over time, we do, I think, get a little bit of that here, maybe. But over time, how does that look? We have 19, 20,
Time.
and 21. I'll come back.
Commissioner Maureen Boyle?
I think, I have a couple questions again. What, on page 8, it talks about how there are certain that there's a percent of same-day book and release, and then about 25% of them are, of those with, in adult court are booked and released the same day, and you mentioned how these are the ones that have like guns charges and things like that. So I guess, can you speak to that? It seems like we're putting some high-risk offenders basically out on the streets if we're only, if 75 or 25% of them are booked and released, those folks are back out on the streets. So.
Well, so I think there's a couple of things. So one, if we go to the offenses, so I'm not going to find it right now, but so the offenses, those are just the most frequent charges. So there could be some other felonies that are nonviolent, but that result in an adult court charge. So it's not necessarily that they're all violent because they're charged in adult court. So that would be one component of it. And then I think the second component is that it is based on the risk assessment instrument that is given by probation and through their intake process. So they may have a serious charge, but not one that requires detention in order to be managed. So maybe if there was an incident, if there was an assault that occurred in a home environment, maybe there is a temporary alternative placement that the youth could go to that would keep the family safe, that would keep the youth safe and provide everybody with the services they need while maintaining that separation. And it's a way that we can manage the situation without the use of detention. So without having specific case studies to sort of point to, those would be just some of the examples that come to my mind.
Yep, that type of example really helps. Good, good. And then secondly, what do you attribute the decrease in admissions to the youth center? Have there been systemic changes, or can you allude to that?
That I think we're still learning. So I think COVID was a lot of it. I think as with everything, once we were in COVID and we had to change our operations just in life, we learned that we could do things differently and we could manage things differently. So I think some of it is just we learned how to do things differently and we're maintaining that. And then I think there are just some other things in terms of charges or in terms of what probation is doing that we need to look at those other system points to help inform why our admissions are going lower.
Okay. Do you think it has anything to do with the diversion programs, or?
I think that's definitely a piece of it. I just don't know how much.
Is there any way you can tell like which those kids have been helped with diversion programs, how many kids are cycling back into the system?
Yes, I think once we get some more information from the county attorney's office, and then once we can combine that with the information from our juvenile assessment center, we'll be able to really look at that and provide a better answer.
Good deal. Thank you.
Thank you.
Commissioner Friend?
Thank you, Madam Chair. Abby, thanks for the information. These are always, I've talked to Commissioner Rogers on from a cursory standpoint, but these are always good, and they provide, for everybody, it provides a tremendous piece of information that people can grab and dialogue about. So I don't want to go too far down that rabbit hole, but there's a lot of good information here. I think in addition, and again, I'll talk to Commissioner Rogers about it and other commissioners, but I think in addition to what we're actually receiving, how valuable would it be? One of the things that I thought about doing in a November Criminal Justice Subcommittee hearing or a meeting is to actually vet or analyze specific crime statistics. Mm-hmm. So in other words, if OPD or the Sheriff's Department were actually going to give us statistics from A, B, and C shift, that would indicate they get a certain amount of 911 calls in this particular time, in this particular zip code. How valuable would it be when we start tracking down that? Or there's 2 zip codes, what type of crimes or what type of representation is actually happening in this particular spot at this particular shift? That type of stuff incorporated with a little bit of this information might be even more valuable. And you're a statistician. Am I wrong about that? I mean, and I'm not saying we inundate it with different stuff. I'm saying we incorporate it into something like this, which would provide certain types of answers to disproportionate minority contact, for example. I'm not saying it doesn't exist. Of course it does. We see the statistics. Question is, we always ask ourselves, and it's always open-ended, why? We do it nationwide. Why does it happen in Chicago, Cook County? Why does it happen in Ramsey County? Why does it happen in Douglas County? I think some of those statistics would be quite valuable, and I guess I wanted your thoughts as a statistician and whether something like that would be valuable, right? I think it would be, but.
Yeah, so I'm always open to more data. Give me
Right.
everything, I will work with it. But no, I think that's very important, and I think you bring up a good point, because if we're looking at sort of the 911 calls, what I'm presenting on is sort of the back end of the system. So we don't necessarily control who comes in the front door. We don't necessarily control who goes out. And so if we're able to get information on those 911 calls on what's happening in different parts of the city, when and where, then that can also give us some really important information to know what sorts of early intervention and prevention resources we need in the community. And then for those people that we can manage outside of a detention environment, what are those structural supports that we need to give to the youth? What do we need to give to the family? How can we help provide the wraparound service of care? So I think that's a very important thing. I would definitely think that would be useful.
Well, again, again, I'll talk to other commissioners about it too offline, but I just wanted to make sure that we weren't stepping off the rails in order. Are we adding value by adding more statistics that would be front-loaded, right? So in
Yes.
other words, we know what the numbers look like. We know what zip codes are being represented. We know who's being pulled in, or our court system's actually dealing with. The question is, and we may not get to the answer, but some of the statistics might provide the answer to why.
Correct.
And how do we incorporate them into not just juvenile justice reform questions going forward, but corrections in general? I mean, so anyway, not to make a speech about it, I'm just curious, and again, we'll take it off, but curious how to incorporate some of those numbers to actually answer some of those questions. So anyway, I digress. Thanks, Abby.
Thank you, sir.
I think, Commissioner Friend, that's a really valuable point, because it was actually brought up during our corrections conversation, or when Mike Myers was here giving the report, when we start talking about the disproportionality of adults in our correction facility and children in our detention center. We can sit here and talk about it all day long, but we don't control who comes in, and we don't control when they go out. And so my point was exactly that, is let's look at that data on the other end of things so that we can see what's going on out there that is leading to those youth, the minority populations being brought to the youth center. To me, that's valuable information.
I agree.
And including those 911 by zip code calls I think would be extremely valuable. I'm also encouraged by what we're seeing and what we're doing here in terms of looking at and continuing to analyze and continuing to change up our processes to see how we can serve our youth and families better outside of the juvenile justice system. And our numbers are showing that. And so I appreciate the data that you bring to us for us to analyze, and we can always use more, obviously, but I appreciate the work that you've done on this, so thank you very much.
Thank you.
All right, with that, no other questions or comments? Commissioner Kavanaugh?
Just quickly following up on a question that we addressed earlier, and this goes to some of the things that Commissioner Boyle and Friend were bringing up. If we could get, this overall kids arrested and charged question addressed as well, then it would help us get to okay, here's the percentage that are being diverted or at least not detained. And I think that that's a real key to this average daily population thing. It would also be helpful if we backed up if possible, the race breakout on the same basis. it appears to me that this starts with point of contact, which is children are being apprehended. And it appears that they're being apprehended in disproportionately large numbers in a couple of select communities, and it appears that those select communities also happen to contain a disproportionate number of children of color. Whereas if you look at the map, there are whole zip codes where apparently no children are detained, and if you go back, they're never detained. I mean, I've seen zip codes on these maps going back years now, and there appears to be areas where all of the kids come from and areas where none of the kids come from. That's, you know, a question that is beyond our control, has been indicated. We don't apprehend people, but it'd be interesting to address that. The overall number of kids detained and then the number of kids, the overall number of kids charged and then the number of kids detained also would give us a grasp on the effectiveness of these programs, which we all want to see succeed. The effectiveness of, you know, diversion programs, the non-incarceration alternatives, everything that we're trying to do to lower that population. So if you could bring that to us, that overall number, and then maybe break it out by these number of kids were released on their own recognizance, and these number of kids were not charged, but they were diverted into XYZ program. That would give us, I think, going again to Commissioner Friend's questions, a metric of what's working out there, or not working for that matter, so that we can give, you know, support success if we have to put some resources behind it. The report is great. Please send it to us electronically. I don't think I have an electronic copy of it. I'd like one. Thank you.
You're welcome, thank you.
Louise?
Luis Jimenez, 2709 Dewey Avenue. Okay. Just a couple points on this discussion. I've heard differently that you can control who goes into the detention center, or corrections, probably the juvenile detention center, that you as the Board of Commissioners and the Board of Corrections can tell Mike Myers not to take people in. For example, last year when there was 125 protesters who were gathered outside the correction center during the pandemic by the Omaha Police Department, is that a situation where the Board of Commissioners could have come in and said, stop taking people in? If that's the case, then I imagine that you do have control about who goes into your system. However, I will take your word for it that you guys don't have control about who goes in and out. I was looking at the map with the zip codes, and I thought that perhaps a reason why there's a proportionate, probably not a big impact, but walkability. The urban core, people walk more. They're using public transportation and whatnot. Out west, not so much. People aren't going through neighborhoods to go where they need to go. They're taking a vehicle. They're taking, maybe on Dodge Street, they're taking the Orbit. So that, I was thinking about that. And then I see that your, and this might be better for later, but your youth and child and youth services committee, are these subject matters? Youth center, juvenile court, juvenile assessment center, are those subject matters, or are they subcommittees or committees? And if so, I think that that's a subject matter or a committee. Here, you could have youth programs, youth intervention programs. Thank you.
Anyone else wishing to speak to the board on this issue?
Larry Store, 5015 Lafayette Avenue, Omaha, 68132. I remember way back when my statistics professor on the opening day informed us that the statistics are nothing but lies and damn lies. Yes, we have to justify our spending and our positions, but a lot of those statistics don't tell the story. If you look at those statistics, it refutes the idea of disparity because it says 70% of the people there or whatever are white. It doesn't say, well, maybe that's because somebody was released early or was never really detained. We don't discuss that, do we? But we build these places with our tax dollars to keep them from going down here to that new center that we already more or less decided on without a vote. We don't discuss those things. In the line of the statistics, and the presentations today. Another thing that stands out in there is the word disproportionate, disparity, equity, race and ethnicity, anywhere from 11% for black to 12% for Spanish, and oh my gosh, 70% for white. But maybe I was confused. Maybe that should be reversed as another topic. All the admissions are down. Of course they're down from the youth center if you don't detain them. One way you don't detain them is you don't detain anybody under age 11 or something like that. But we don't explain that to the citizens, do we? They're dispersed into the community. They're released to home programs, maybe to aunts and uncles. But fear not, we will have another one-stop center for all these programs that are best practices from somebody out of this state, somebody out of this city, some expert on mental health that wants to blame all the crime that the youth commit or have been arrested for or charged for on mental health or ADHD, anything but they're just plain guilty. And then we're going to fix them. I don't think so, people. I hear every day there's another North Omaha shooting, North Omaha knifing, but we don't hear about all the burglaries and stuff. I mean, that's a fact. I know you don't have time to watch the nightly news, but every night practically. Why have we not fixed things in North Omaha? Maybe the crime there is disproportionate, higher than other areas, such as a zip code where I live. That's not my fault, and I'm sick and tired of reading that it's disparity and hearing that it's still my fault. We're still guilty of everything past, future, and present, and it continues. It's time to change the words if you don't want to be thought of that, the words that it implies. It's continuing racism, but it's reverse racism. And if you haven't noticed, school boards, oh yeah, people like me are finally getting up at school boards. And then of course we're criminals and we're the revolutionaries, and we are completely out of order. Now last week there was a black lady that complained about this youth center.
1 minute.
She got rather mad and louder than I ever got. And oh my goodness, she wasn't called out of order. She wasn't dismissed and she wasn't escorted out. I have been. And I think that's disparity. So we got to stop it. Change the words, change the message. Thank you.
Anyone else wishing to speak to the board? Or Commissioner Rogers?
I don't want to waste time responding, but I just need to say for the record that that was one of the most uninformed string of comments that I've heard in regards to this issue. Thank you.
Kim?
Good morning, Commissioners. Kim Habakati, Deputy County Administrator over our juvenile justice reform efforts. Just a quick update on some of the programs and services that we are doing. I'm going to concentrate on two main areas today: our prevention and early intervention services, because we all know if we don't deal with some of these issues earlier, it's going to impact the back end. Second thing is just some of the updates we've been doing at the Douglas County Youth Center and our programming there. So in the prevention early intervention area, we have our community-based grant funds. So for this year, we have $1.3 million in funding this board approved. It is going to 12 service providers. I have a list on this as to who those what those services are. I do want to say, and what is important, referring back to the graph that Dr. Carball used with regards to our zip codes, these services are located within those zip codes, and we were very strategic in the selection of services and what the needs are of the youth and families in those communities, and we targeted our funding in order to deal with that. Our 2023 grant year process is going to be beginning in the next month. We also have as prevention early intervention services our Douglas County Community Plan. It's a 4-year plan. It was approved by all of you with regards to the direction that we're going in juvenile services. On this slide, it does list the 4 key strategic priorities, and I know we've talked about these before, but I just wanted to remind, and of course, one of them is ensuring equitable treatment for all youth and families. As Commissioner Rogers stated, we did at Children and Youth last week have a very long, in-depth presentation on our family resource centers. This is just a slide to say that what a family resource center is. It's really community-based spokes with a central hub that would serve as a single point of entry that would provide that comprehensive, intensive, integrated, and collaborative community-based services for our vulnerable youth and families. It would be community-driven, located in the community, working with the families in the community to ensure that their needs are met. Where we're sitting on it, because I know all of you have heard us talk about it, is we've completed an environmental scan of our entire county thanks to a private donor. We've created a logic model for a family resource center, and we're now working on the implementation phases of it. Other prevention early intervention services we've been working on in the last quarter has been our missing runaway youth. We know at any given month we have between 80 to 100 non-system involved runaway youth in our community. We also know, based upon our data, that when we looked at our youth charged in the felony system, many of them had numerous missing runaway reports prior to the commission of the felony. So part of our prevention early intervention services is to provide the services needed for these youth and families. We've developed a process working with Project Harmony and Omaha Police Department to meet the needs of these non-system involved youth. We've also been working with Metro and the Department of Education. We need alternatives to high school completion for our youth and job training, so we're bringing a lot of those services into specific schools. The other new area we've just begun working on in the last 30 days is working on more of a community-based crisis response system for our juveniles. We've set up a work group working with Omaha Police Department, Region 6, community providers, so that we get that early response out there instead of having to bring kids into the system in order to get their needed mental behavioral health needs. With regards to the youth center, some of the changes or things we've been able to accomplish this last quarter, the board has approved contracts for our stability services through our home program. That basically extends our home program, our electronic monitoring system, to include other services to keep you safely at home. There's a list of the type of services. If you really look at those services, they are in-home family supports, working with the youth and the family in their home with the electronic monitor to keep them out of detention. We have seen our numbers of the home program in the last 30 to 45 days go up by about 25%, which is a good thing. So the judicial system is working on us to get these services for the right kids. The other services we do have within Douglas County Youth Center is our crisis response team. That's a contract currently through Region 6 to provide 3 therapists. It's our belief at the Youth Center that we also need our own in-house therapists, because we've seen what a positive effect it has had on our youth to keep youth stable while they're in the youth center, and also then to provide that navigation bridge for when they leave the youth center to get the services also available in the community. And I know we've had presentations on the behavioral health initiative. That is continuing to go forward. We were just looking at some of the beginning data, and what we found with the behavioral health initiative, previous to it, evaluations and assessments on youth in detention were taken anywhere from 6 weeks to 3 months, and we're now averaging 3 weeks to get the evaluations done, which is moving youth faster out of detention into the appropriate services. The other thing that we're doing is we are implementing what's called the MAZE 2. It's a mental behavioral health screening that will be done on all youth as they enter detention to determine what their mental behavioral health needs are, but also to make and assist us in determining which youth have a suicidality risk that we need to be able to meet right away. We also have been working on a room confinement and recidivism grant. We were given that grant about a year ago to start working on the use of room confinement within the Douglas County Youth Center. We have completed work on totally revised our mission, vision, guiding principles. We're now working on redoing all the policies within the Douglas County Youth Center towards infusing positive youth development into those so that we are meeting the needs of our youth. Also, next year as planned, staff will be fully trained on some evidence-based practices on how to deal with youth. The next 2 slides, I'm not going to go over them, but these are a list of the ongoing programs and services that are continued to be provided at the Douglas County Youth Center from an educational standpoint, from a family program standpoint, what we're doing with the families, from medical services, to also our social emotional programs. Now, I think the hardest thing the pandemic has done is made it difficult for a lot of our social emotional programs to really operate within the facility. It's really our hope in the near future that we will be able to go back to a lot of them. We've been trying to do as much through Zoom as we can, but we also know that relationships are the keys. Last thing, systemic reforms we've been working on this quarter is we've sponsored, as a county, 3 trainings done by a group called the Wonder Women. But Wonder Women stands for Working on New Directions to Empower Resilient Women, because as Dr. Cobrow talked about, we notice our number of girls involved in the juvenile justice system is increasing. So we had trainings with over 100 people attending most of these trainings dealing with how to effectively assist girls, the LGBTQ+ community, and our last training was suicidality in our Black youth. Future trainings we have coming up is with regards to both our Sudanese population and also our Latino population. I have one comment I'm going to make, and then I'll gladly open up for questions. When we talk about data, we have to be very aware of the situation that a lot of the data the county does not own, that I know there's work being done at the state level to maybe look at statutory changes that would allow us to share a lot of that data information. But we have to continue to look at ways to share it, because Commissioner Kavanaugh, a lot of what you said is data outside of our control that we do now have MOUs in effect to try to get at some of that data. But if it would be much easier if we had some statute that would at least allow all of us internally to share that information. So I'm more than open to any questions.
Thank you, Kim. Commissioner Kavanaugh?
Thank you for this, Council. And I don't know if this came to us electronically, but could you make sure that
Yes,
we get it?
I will.
Okay. To your last question first, last thing. The data that I think would reflect what we're talking about that is under our control would be the cases filed in the separate juvenile court and the district court of Douglas County. Just that number is available. Those are publicly filed. We don't look at the cases. We don't look at the names of the cases. Just the number of cases filed would give us some idea that the cases are up, down, the same. And that's data that we should be able to access without any question. Public data.
We could access the justice system to get the number of cases. I think if you really want to do the deep dive to see what type of cases are being filed in order to determine are the right youth in detention or not in detention, then that's going to require the data from the county attorney's office to see when law enforcement charges a youth, what does the county attorney's office decision, do they noli prosit? Do they file it? Do they send it to diversion? And then we can track what happens in diversion with those youth and also with the filing. So that was the data Dr. Carba was talking about. We now have an agreement with the county attorney's office. We're getting that data. We're trying to synthesize some of that data to get to what it is you want, Commissioner.
So, you know, the overarching number, the beginning of this data analysis that you're talking about is cases filed, kids incarcerated, okay?
Right.
What's the difference there between 19, 20, 21? And that would give us, I mean, I'd like to go back farther, and it should be possible to do that, but at least as a starting point, has there been a change in the cases filed and the kids incarcerated? You know, that's
Right.
the beginning number, real simple, and there's much more along the lines of what you're pointing out in terms of taking meaning out of those over time. But that initial number is the number that I think I'm talking about. Should be able to get that.
Yep.
The evaluations and assessments that you're talking about, I think on page 7, 8, and 10, in terms of the kids getting psychological evaluations and assessments, doesn't indicate that any of these children are receiving psychological counseling. I'm interested in, when we're talking about therapeutic intervention for youth with behavioral health issues, whether or not anybody is sitting down, any healthcare professional, licensed healthcare professional, is sitting down with individual children today at the Douglas County Youth Center to give them counseling, not to write them a prescription, not to do an assessment, not to do an eval, counseling. Is that happening today?
Yes, it is, Commissioner. As part of the room confinement grant, we took some of the funds and the feds approved to hire our own clinical psychologist that is housed within DCYC and is there and is working directly with the youth as a clinical psychologist. We also currently have 3 therapists through Region 6 that are available for a crisis response type situation. So yes, we do have on staff the therapeutic interventions. Would we like to see an increase? Of course, because we know how important it is. But no, we do have that available. And we do have that clinical psychologist, which has been a wonderful addition over the last 6 months.
And I see that on page 8. We might have to come back time-wise, where it says DCYC is one of 2 recipients of a $600,000 3-year grant. A licensed clinical
1 minute.
psychologist
Correct.
has been hired as the manager of behavioral mental health services in DCYC.
Correct.
Is that individual the individual who's meeting and counseling these children?
Yes.
Okay.
Yes, Commissioner.
And so with the population that we have, you know, say 60-some kids, what percentage of them are receiving counseling and on what kind of a period of regularity? You know, if a kid's in school, they're going to math class every day. If a kid's in DCYC, hopefully they're doing something like that as well, but what type of regularity are kids who have been assessed and evaluated and have been found to need help receiving actual face-to-face consultation from a clinical psychologist? Do we know?
I don't have the exact data, of course, Commissioner, more than willing to get it, but 100% of the youth that need mental health services,
Time.
we're
We'll
getting
come
it for.
Thank you.
Welcome, yeah. Commissioner Maureen Boyle?
Yeah, thanks a lot, Kim. So on page 5, when you talk about prevention and early intervention programs and services, I'd like to hear more about the crisis response team, because when I look at it, I'm thinking about how when kids are first in crisis and who's responding to this. I see that OPD is on the list, and I just want to make sure some of these issues really are not criminal issues as much as they're health issues. So can you describe the criminal response system and how we can make sure that the first contact is not necessarily with law enforcement, because that would concern me if that's how the child is seeing the first when they're in crisis is law enforcement first.
What Omaha Police Department has started within the past year, Commissioner, is their CIT program, their Crisis Intervention Program, which is not necessarily law enforcement officers that go to the house. They started in the adult arena. It's more LMHPs and licensed professionals that are going out to the calls that come into 911. They're now looking to expand that type of service into the juvenile arena so that when a call comes into 911 and it's a mental behavioral health need, that it would not be law enforcement, the cop on the street that actually goes there, or if they do go there, it would be in tow with a licensed mental health professional that would be working with the family to try to de-escalate the situation. So that's how OPD enters. I think we have to face realities, and this group is just starting, that most families, when they're in crisis, the first thing they do is call 911. And so we have to, as a system, develop a good response as to how we're going to call or handle those 911 calls. So we're starting at the very beginning, Commissioner.
I think you just hit the nail on the head. That's exactly what I'm alluding to. I really feel strongly that this is a health issue, much less so a criminal issue. And if a police car is showing up in front of the house that doesn't de-escalate, even if it's a licensed medical health professional getting out of the car. So I think we really need to work with OPD in a big way. And in honesty, I've had no conversations with them about this, but I think the image of what's presenting, what's showing up, I think is probably the most critical moment of how intervention will be accepted, how the family accepts it, how the child accepts it. I think, like I said, there's an initial response when it's seen as a law enforcement issue. I think there's an initial response to be defensive and escalate the situation. So I think more than anything, we really have to collaborate with OPD on that initial meeting and make it seem like it's not a law enforcement issue, that it really is a health issue.
And just to be clear, too, the Douglas County Sheriff is involved, too, with this. It's not just OPD, it's also Douglas County Sheriff, so that we cover the entire county.
So my argument is it should be neither, and it should be someone in the medical community. So like I said, law enforcement has a role, absolutely, when those situations can get out of hand, but to start off right away with law enforcement. And you're right, 911, but it can dispatch, and I'm not saying to do this, but an ambulance type service as opposed to a law enforcement type of service. Thanks.
Commissioner Friend?
Yeah, thanks. Thank you, Madam Chair. Kim, as commissioners, the gathering of information and the gathering of knowledge, always important. So this is good dialogue, but I'd like to throw your way. I mean, when we start down this road, and with all due respect to my colleague, if you sit in a 911 call center for more than 4 hours, you realize that what we're doing right now is we're running down a road that is extremely hard to narrow the scope. Am I correct with that? So in other words, 911 gets a call. It's 9 in the morning. 70% of the calls that come in an A shift, for example, for a certain period of time, 70% of those calls result in some sort of, the initial call that they first get at the beginning of the shift result in some sort of domestic violence dispute. Now, having 911 actually be able to determine at that point that this particular item requires a CIT person. The first response in a 911 call, if somebody's in danger, or how much of the information we don't know, is going to be a law enforcement officer. Now, can they bring people in tow with them? Absolutely. The problem is determining right up front, immediately, what the initial problem is. So we're going down a road here that's going to require a heck of a lot more analysis. Am I wrong? I mean, we're trying to say, here's where we're going here. Somebody dials 911 and they have to determine within 2 minutes what type of response is going to occur. I mean, that concerns me a little bit, because that's not how we operate right now. We want to protect the person after a 911 call. We want to protect the people on the other end of the line immediately. How quickly can a resource get there? And we've got a certain amount of resources out on the street with OPD and also the Sheriff's Department that can get there quick. And they don't have time to start going out and grabbing other people. I don't mean to go off on a tangent. What I'm saying is I think that these are discussions that are have been going on for a long time, and we also have to step back and actually do that analysis that Commissioner Boyle was talking about. We're not going to solve these without including, as she has pointed out, law enforcement to decide what those danger points are in a 2-minute call. I mean, we're creeping down a huge analysis road here. And maybe we take them into some of these subcommittees, talk about what the statistics look like, and then also talk about what 911 thinks of those statistics and how we can actually move to that next level. Resources are thin. I don't know, now I'm just brainstorming. I mean, the bottom line, this is a scary discussion because we don't have 911 sitting in this room talking about what those calls look like in the first 20 minutes of an A shift. So, I
Commissioner,
don't know,
my
Kim,
only
any
comment,
thoughts at all would be great right now.
my only
I don't-
comment would be with regards to that. That's why we put together this work group, because we understand we need all the relevant stakeholders at the table before you do any type of systemic response. And you really need to look at the data. And that's why we've just started it and said, we've got to get the data. We've got to figure out the current system, who we all need there. Do we have the right people there? We're just starting with it, and I would welcome any commissioner that wants to join our work group to please join it so that we can. So,
Kim, thanks. I didn't mean to go off on a tangent. I'm trying to brainstorm things in a meeting, and it's probably not the best place to do it. So, thank you.
Commissioner Kavanaugh.
Thanks. Okay, so following up on what we were talking about in terms of the kids actually receiving psychological counseling, the grant that is mentioned on page 8, the DCYC is one of 2 recipients for a $600,000 grant, 3-year grant. This funds a clinical psychologist at DCYC, right?
Correct.
Okay. So 600,000 over 3 years split with another entity. What's the other entity?
No, our portion of it was 600,000.
Okay,
So we have
great.
200,000 a year for
Okay.
3 years.
So what's the cost of the clinical psychologist? If you know.
I'm not really sure. I want to say it's between the $90,000 to $100,000 range.
Okay. Do we have more than one clinical psychologist coming on staff?
No, just the one full-time.
Okay, so that 200,000 is for the clinical psychologist, and then what's the rest?
Well, the rest of the grant, like it says there, is to be used for different training for our staff and some items like that. I can gladly get you the full grant application if you want to see it and where we're expending the money on the grant.
Okay, that'd be helpful. The other thing is, you know, what we talked about in terms of the actual services being provided to the kids. If we were talking about this math class thing, you know, you could tell me that there is a teacher teaching math to X number of kids 5 days a week, okay? That's kind of what I'm looking for in terms of, there's a clinical psychologist sitting with X number of kids 5 days a week. That's what I'm looking for. Where the rubber meets the road on this entire initiative is a clinical psychologist sitting with a child doing some counseling. And so if we can get that, and I don't expect you to have it right here, right now, but that would be helpful, just so that we know, okay, well, we're providing this. And, you know, it's a part of that larger picture that Commissioner Boyle was talking about in terms of the crisis intervention thing, and I totally agree. The first face in the crisis intervention thing should probably not be a law enforcement officer. You know, the crisis that we're trying to intervene in is not going to be solved by law enforcement. It's going to be solved more by something like this, where counseling, whether it's a clinical psychologist or a finance advisor or an educational advisor or whatever, is going to be more helpful than a law enforcement solution. I think that's where we're trying to get to. So my question is, let's try to quantify this particular little piece of that overall thing, if we can. That we have now a clinical psychologist, good. That we're training our staff to join in on that, equally good. What are the kids receiving in terms of counseling? And if we could quantify that, and like I said, don't expect you to do that to right off the top of your head here today, but I'd appreciate that as a follow-up. Finally, in the new kids' jail, there were a couple of deficiencies that were noted. One was there was no kitchen food preparation in the entire building facility, and the other was there was no laundry in the entire facility. Have those been rectified? Do you know?
Commissioner, with regards to the laundry, we do have an external laundry service that does all the major laundry. We did add a washer and dryer back in the booking area that could be accessed to do laundry services
Okay.
also.
And that general laundry service, where is that located?
It's taken off-site. I'll have to check into that. I'm
I
not sure
understand.
who that actually does.
Might be on 42nd Street where the youth center is. And the food, lack of a kitchen and food prep?
There is in the tower, there is a food prep area that is there. Food right now is being planned to be taken from the health center where we currently get it, and vans have been purchased to bring the food down to the new facility once it's operational.
So again, the food will be provided by the 42nd Street facility where the youth center currently is.
By the health center where it currently is.
Yes, the health center
Right.
that's next to the youth center on 42nd
Right.
Street currently. Do we have an idea, or do you, and if I don't expect you to automatically have this, what the cost of those, fixing those oversights were?
I don't, Commissioner.
Thank you.
If there was any cost, I don't know.
Yeah.
Commissioner Morgan?
Kim, I think you've been here, what, 3 years almost? Is that
A year and a half.
year and a half? Probably seems like 3 or 5. But I just want to thank you. I've called you a number of times, and I really appreciate the passion and the caring you have to do the best job we can with our youth. And I really thank you for that. I think we're very fortunate to have someone of your caliber working on this program and trying to do our best. And I thank you for that.
Thank you, Commissioner.
Commissioner Rogers?
Thank you, Madam Chair. Just based off the comments today, I just want to make 2 comments, and one is just to that side that that Kim had up now, and the term that was made. I mean, I think everybody needs to just know the term made that this is not where the rubber meets the road. This helps, but the rubber meets the road, to me, is always outside here. The kid getting service here just puts us up on par where we're trying to get to make sure that there's adequate health services there. And we've had health services, but as we've grown more throughout the years, this is about putting us on par with, for instance, adult has a medical director, they have mental health staff. This is getting us up to par there. To me, the rubber never meets the road with the kid getting services in here. That rubber meets the road outside where they should be. And that kid that's getting that service specifically on the screen, those kids should not get that behind the walls of a facility if they have a mental health deal. And that's the same issue that we're preaching with adult. And so when you take a kid in, that's just as much that. Second comment that I'm gonna make, and I'm gonna put it this, words matter. So just like now the term for people and adults is you call them returning citizens. You don't call them ex-offenders because of the framework that puts us in. You can keep using the term kids jail as derogatory, but you can't say kids jail and then say out of your same mouth that you care about the well-being of the kid. Because the framework that you're saying is saying that kid is there, and that's not what juvenile rehabilitation is about. It's the same philosophy that you use when you have sight and sound. And that's why the law does not allow kids to be in sight and sound of adults. So if you want to say out of one part of your mouth you care for the development of the kid and you want to call it a kid's jail, you're inconsistent on that. Because you're framing it up and putting it in an instance where that does not work for the development of that kid. Thank you.
I'd like to go back just for a minute to the crisis response because I've been kind of on this bandwagon for a long time. And these discussions have gone on for a long time where law enforcement did not want to be involved in answering behavioral health, mental health calls because they're not the experts. So there are systems out there that I think we need to take a more in-depth look of those responses that don't include a law enforcement response right off the bat. And you're right, Kim. Right now, the only system in place for people, because there isn't anything else, is to call 911 for help. But come July of 2022, we're going to have the 988 number. And that's going to be answered by behavioral mental health professionals, which I think, again, we're going to have a lot of education. I've been working on a state committee for it, a lot of awareness building for folks to make sure that they call that versus the 911. But nobody has ever said that law enforcement is completely out of the picture. We obviously know there's going to be situations in which they need to be there. If you go back and tune in to our listening session, this was a pretty a point that was made over and over by people who experienced. I've never experienced it, so I can't talk about it. People who experienced a mental health crisis and the response that they got over and over and over and over and over again, the issue was we need a different system other than law enforcement responding to my mental health crisis. And so we're working on that, we're looking at that, and that's a good thing. And that's for not only the adult system, but it's also for the youth system. There has also been conversation about embedding a mental health professional within the 911 center to be able to assist in making those determinations when those calls come in. But again, hopefully the 988 number, which again has to be coordinated with 911, that's the other thing we're talking about, but they can be helpful in helping those 911 employees because they're not the professionals either. We also use some of the ARPA funds, if you remember. We've approved the training of all 911 operators to do this, to CIT trained. I think that's a huge piece too. So again, I think that when it comes to response, we have to really look, as Commissioner Boyle said, and that we talk about all the time, as mental health being health. We have to look at it as a holistic and not a separate. And so I'll, Kim, get a hold of you because I would like to be a part of those discussions as well on that crisis response, which I have been through Region 6, but a little bit more now on that. And to Commissioner Rogers' point, we want to start really taking a look at, again, how do we address these things outside of our facility? There's kids there, when you look at the length of stay, while we're not satisfied with those numbers yet, that's really not a long time to be able to do what everybody thinks needs to happen at the youth center. The youth center is not a place where kids go to stay. The youth center is a place where kids come and then the courts decide where they're placed. And so we need to remember that and not to think that the youth center is the end-all be-all that can address everything, but that we look at to the outside before they get into the system, and we look at the inside where they're leaving to make sure they have the tools and resources they and their families need so that they don't come back in. I know I'm preaching to the choir looking at you as I'm talking. You're doing a fantastic job since you've been here for us. And this board is committed to that, making it better for our youth and families, because really in the end, that's what it's about. It's not about us, it's not about you, me, it's about the kids and the families we're serving. So thank you very much for the work that you've done and the report you've given.
Thanks.
With that, Larry?
Excuse me. If I understand correctly, this is still a presentation. It's really unclear whether a citizen can come back up again or not, but I will.
I wouldn't have let you if you could.
Okay, but
Solves that problem.
All right, first of all, I cannot understand your words. I cannot hear you with the masks on. That's a violation of the Open Meetings Act. I don't know whether somebody threatened your jobs, but all of a sudden you all wear masks. Well, please do something with the sound system. I've never had a problem when you don't have a mask on. I do have a problem in the afternoon because they wear masks and they don't speak in the microphone. But a lot of this is a derivative of going to other associations for learning about what are best practices and what aren't. Now, you people could make a judgment of me very quickly. You have a mental health person here. According to my checklist, he's got a mental health problem. Police might be driving down the street with one of the ride-alongs that you haven't decided on. Oh, I'm sorry, that's the city. But they might see my flagpole with a flag flying upside down and at half staff right now. Oh, excuse me, I think that guy has a problem according to my checklist. It goes along with what my friend is saying. You know, some of this stuff is right out of 1984 or Soylent Green, and it really needs to stop. Don't spend my tax dollars going somewhere to listen and get a copy of someone's best practices. You have people here in Omaha, here in the state of Nebraska that you can listen to. And that guy that you go to for counseling for 1 hour a week, 1 hour, doesn't necessarily know you, doesn't understand you or your mind. Thank you.
All right, and Luis?
Thank you. Luis Jimenez, 2709 Dewey Avenue. I see there's going to be 7 commissioners. I would like to receive this report digitally. So,
It's on the website.
it's on the website? Okay, great.
Yep.
I agree with having a full-time psychologist on staff. It makes sense. I'm not sure where they're going to be located. Probably in the new detention center when it's complete. And I also agree with looking at crisis management beyond the dispatch. I think that sending somebody to the location to determine if law enforcement is needed, I think that is smart. And it's not, it's not like there's a gun in every household here in the United States. We like to think that it's like Chicago. They both reach for the gun, they both reach for the gun. But we need to take a serious look at systems, at the system. Speaking about Chicago, they have case managers that go out without police. They may actually be have a firearm on them and stuff, but they act as case managers, and they're not there to necessarily arrest somebody, but they have the training beyond what law enforcement has to deal with a situation like a crisis. Thank you.
Anyone else wishing to speak on this issue? Seeing none, we'll move to committees. The first committee is the Finance Committee report as presented. The next is the Human Resources, the Civil Service report as presented. No legislative items at this time. We do have need for an executive session for labor, litigation, and legal advice.
Just litigation and legal advice.
Just legal, okay, no union negotiations. Okay, do I have a motion to go into executive session for
So
those
moved.
reasons? Motion by Commissioner Friend, seconded by, who has her hand? Oh, Pastor, good morning. You're on mute. There you go.
Yeah, good morning.
Hi. I didn't
Good
see your
morning,
hand up. I'm
commissioners,
sorry.
Pastor Portia Cavett, Clare Memorial United Methodist Church, and a Douglas County resident. I apologize for not being present in person, but I have a question. I am concerned about learning that Douglas County Health Department is not giving out the Moderna vaccines in their pop-up clinics. And I'd like to know why, when most persons in North Omaha, that's when they were eligible for the vaccine earlier this year. And now that it's been approved by the FDA and the CDC, I want to know why our health department is not administering those vaccines in pop-up clinics, and especially in North Omaha.
Thank you, Pastor, and we will get a hold of the health department immediately following going into executive session and find out that answer and get back to you ASAP.
Appreciate it. Thank you.
Yes, thank you. Good to see you.
You too.
Okay. We had a motion by Commissioner Friend, seconded by Commissioner Morgan to go into executive session. All right. Please vote. And again, litigation and legal advice.
Motion passes 6-0.
Recording stopped.